Welcome to Understanding Behavioral Health podcast. This podcast is designed to provide information and resources to our tribal communities on a variety of behavioral health programs and topics. Our goal is to help you find and support you need or to find the support you need to live a healthy and fulfilling life. We believe that everyone deserves access to quality behavioral health care regardless of their background, circumstances. That's why we're committed to providing culturally appropriate services to tribal communities. We know that healing is a journey, and we are here to walk with you every step of the way. And my name is Jordan Maninek. I work with the Victims Resource Program. I am a victims advocate.
My name is Rachel Gregg. I am the Social Marketing Communication Specialist for Systems of Care.
And I'm Bobby Joashu. I'm also a victims advocate for VRP.
And today our special guest is no other than...
Hi, I'm Nocona Abrams, and I'm a therapist too at Yakama Nation Behavioral Health, and I'm also in charge of implementing the school-based health clinic at Yakama Nation Tribal School.
Nocona's been on a podcast with us before, and last time you guys met her, she was actually running the Healthy Transitions. Recently, she just became a therapist, and how's that been going for you?
Yeah, it's been really good. I was doing it part-time already because behavioral health allows for practicum students to come in, kind of like internships. So I was kind of doing that part-time and then doing the Healthy Transitions program part-time, and I felt like they really kind of like were multi-beneficial, so they kind of benefited each other, you know? So I really love that I got that experience in that role, and now I'm kind of able to use that in the work that I do now as a therapist. Okay,
so as a therapist, what are some of the things that you're able to? What kind of help can you provide for your clients? There's like anger management, different things like that. Like, what services do you work on?
So we have a lot of different things. So I always tell, when I meet clients for the first time, I always tell them, like, therapy looks like what you want it to look like. Like, I don't have any expectations of you other than, like, you commit to, like, being emotionally honest with yourself. So we do have some therapists on our program that do like the anger or the DV assessments and that kind of stuff, like more court ordered if it's through the Yakama Nation court. But then we also have some therapists that kind of specialize in that like substance use area. We have some trauma therapists. So for me personally, I am kind of like working with a lot of clients regarding grief because I'm a grief recovery specialist as well. So that's kind of a lot of the work that I do is that. But I really love working with the young adult population, like the teens kind of area, middle school, high school, straight out of high school, kind of that area. Of course, I have other clients as well, but I really enjoy that because that is really helpful, especially implementing this clinic because it is in a middle school, high school, at tribal school.
So, how do we get people in there for that?
For therapy?
Yeah.
So it's all coming into behavioral health. Now we're trying to like mainstream services, like the intake process for every program. So we're trying to make it like easier to access services and also access multiple services at the same time within behavioral health. So part of that is shifting the intake process so that we have all our different programs on the service request form. So basically, like, if someone in the community wants to access services or someone wants to refer services, we always recommend that the person that's requesting services knows that they're being referred, right, for one. Yeah. But if you want to self-refer as well, you can fill out that service request form and just mark all the services you want or are needing, and then they'll get you connected to all the different services there. So say someone is like, I need individual therapy, so they'll get that service request form filled out, and then there's some paperwork just like regarding like our privacy statements and things like that, our consent to services, and kind of like so they know what to expect from us as well.
Yeah.
And then like liability stuff, right?
Yeah.
And then once that paperwork's complete, they complete the intake with one of our intake therapists or specialists. And that's just to get some background on, like, why are you coming into therapy, and also, like, who are you, and what have you experienced, And then they use that to try to, like, match the person to the therapist that will be most likely to be able to meet their needs, if that makes sense.
Oh, okay.
Yeah, and that's, like, coming in through the office. If they come in through the school or from a different program, it's a little bit different. But we can talk more about that as well when we talk about the health clinic.
Yeah. Thank you for. I just kind of want to dabble into that therapy thing real quick. And I know before you transferred over from Healthy Transitions to become a therapist, you had a project that you've been working on to get into the tribal school. And so, can you talk? Like, how did that start? Like, where did this idea come from?
Yeah. Well, so like I said, I was a practicum student. So this was something that our director and then also the clinical supervisor had kind of brought about, like this idea. This was like over a year ago. This was like last spring, maybe even. And so it's been a while since we have been trying to like figure this out. So they just basically came to me and they were like, yeah, we want to do this, we want to implement a school-based clinic. This is like a new thing. Like this, like, just so you guys know, like, how new this is, like, there was only one other school-based health clinic in the area, and now that one is shut down. So right now, is what I've been told. So right now we're kind of the only school-based health clinic that's operating like in this general area, and definitely on the res, right? So this is like a really new thing, but I think they had heard about it, and they just asked me, like, as part of your practicum, to gain some experience in like implementing and focusing on all those core competencies, would you be willing to kind of take this on? And I was like, yeah, that sounds like a really great idea. So I took it on as part of the Healthy Transitions project, and then I kind of carried it with me over into my role here. So that's kind of how it started, started as an idea like several, like over a year ago, right? It took several months of just planning, figuring out what that even looks like what is a school-based health clinic, and then kind of bringing together all the pieces, right? Like all these small little pieces coming together to create this big picture. Yeah.
So
Sounds like a lot.
yeah. So who else is besides you and I guess the clinical who else is involved in doing all this?
So I'm gonna shift it to the health clinic flyer here. So here we have like the different programs. Well, we have the different services that are listed, right? But as far as programs, we have several of the behavioral health programs involved. So systems of care, healthy transitions, victim resource program. We have our physician assistant also on board. And then we have med management as part of that as well, Marley. And then we have like Chestina, the cultural specialist, kind of goes into the school as well. We have some of our behavioral health aides coming in. We have the clinical team, obviously. So basically a big bulk of behavioral health, right? And then we also kind of expanded it. So we started there. We were like, what can we offer, right? So physical health care, right? That's a lot of like what Kate does. And that's like things that we had to try to like alter of like, what are the students going to need? And then behavioral health care, obviously, which is a lot of what we do, as well as like community and individual well-being, and that's a lot of like things that like Healthy Transitions can support with, that like SOC can support with wraparound, VRP can provide that kind of like case management as well for victims, and then also just like on a broader scale, like education, like what can we do to educate about healthcare and how that looks different, how that has so many different components of being like healthy, right?
Yeah.
So they wouldn't even have to leave like campus to go to the clinic. It would be right there at hand for just students.
Yeah. Yeah.
Well, that means they can't play sick then.
They got a doctor's bed right there.
Gotta go to school to see the nurse.
Gotta go to school to see the nurse.
Can't call my mom. Are you sure? My stomach really hurts.
Yeah. Well, so on that note, then we also, I'm going to switch it over to the nurse flyer. So we partnered with Heritage and ESD 105, who is bringing in a part-time registered nurse. And so it's kind of cool because we're able to share the space with her and kind of have some overlap of like she's there a majority of the time, and then we bring in our physician assistant who is there opposite time, you know, so we can kind of cover just as much. That's kind of the goal, is like basically having like behavioral health or physical health presence on campus like the majority of time that students are on campus. Yeah, so we partnered with them, and that's been really cool. We have some big dreams to get just like so many different other things in here as well. Like we want to partner closely to get more like substance use services in here, partner to get like maybe like eye exams, like vision and hearing exams, you know, getting some of those specialists to come in. So we want it to be just like basically any part of health that you could think of, like we have someone that can meet that need, you know?
Yeah.
Mm-hmm. So this is really good for tribal school, right? So is this going to expand in the future to different schools?
Maybe. Right now we're going to start small.
Right.
But obviously that is the goal, is like we've already had people coming up like, can you do this at our school, you know? And so it's been obviously a big process of figuring out what this looks like. But that's part of the goal, is like getting like the basic like ground level model of this school clinic, and then kind of nailing it here, right, at tribal school, and then maybe taking that and kind of like copying it out all these other schools that are on the reservation to increase access to services across all schools, right? Another big thing too is that like right now it is just students, because to my knowledge tribal school is very they really want to keep, like, they love the safety of their students, right? They really, like, that's one of the biggest things to them, and so they don't allow just anyone to come onto campus, right? But thinking about, like, how could we involve the community more and, like, go to the community in different spaces, you know? So it could end up being something that's not just school-based, but, like, community-based around, rather than just, like, our general location, right?
This is a lot of real great, amazing stuff. It's just like, you know, hearing about other schools like, hey, can you do this with us? Can you do this with us? And it's just like, but Yakama Nation is just like being put on the books for something else, you know, in a good way. And this is just really cool. So, like, is it like other surrounding communities, you know, other school districts like around us that are asking you to come in, or is it like are they other people from like different reservations, or? Yeah,
it's schools that are on our reservation right now. But there are a few other school-based health clinics in Washington, and I think it'd be really cool to just like go visit there and like tour their facility and see like what services they offer, also like their workflow, because that's something we're still trying to work out. And tribal school, their administration and staff have been super supportive and like very involved in trying to like establish this workflow and just like create harmony, right, for the students and everything. But obviously, with any new thing comes like a lot of trial and error, right? So we're still in that phase. We had only just launched this on March 27th, so it's like very fresh, very new. So we're just still working out some of the kinks and everything, but already we can tell it's definitely like increased access to services for the students. So I mean, really, we can only go up from here.
So this became like an idea from like your directors, our directors, because we all pretty much are in the same place. Why?
Why did it become a thing?
Yeah.
I think the biggest thing is because, one, tribal school, and they had shared that they are 100% IHS eligible students. All the students are IHS eligible this year. And so that is like, think about that. Like, that is who we serve. That's our population as behavioral health, right? So, and I have here the school-based health clinic core competencies. These come from Washington School-Based Health Alliance. And this is kind of what we based our model off of. The biggest thing is access, ensuring that these students have access to healthcare and support services to help them thrive. I think part of it is because you think about it, like, you go to a job, maybe you can take like some time off work, but like with education it's a little bit different, because then, you know, especially with transportation being such a big barrier in our community, parents having to work their job, not being able to like go to school and take their kid to our clinic and then taking them back to school, then going back to work, you know, that's a big commitment. So if we can just go to where they are, then that's immediately going to access services. It's like you said, they don't even have to leave campus. Like, and then not only that, like, this goes bigger than that. I'm going to switch it back to the one that says physical health care on there for the tribal school clinic. So like sports physicals, like things like that. So this is like student focused. That's the second core competency, is student focused. Like, what are the needs of the students and how is that unique to them compared to like other people that we serve, you know? So like one example is like sports physicals. Like, sometimes like students don't get to go to sports because their parents don't have the time, or their guardians don't have the time to take them somewhere, or maybe they don't have the money or whatever to go get that sports physical, and so they miss out on their opportunity, right? So it's like things like that.
I've had some nephews or nieces, I can't remember who it was recently. I was like, how come you're not playing sports? Oh, I can't go get a physical, nobody there to take me.
Yeah.
And like, you know, like, I know parents, are busy doing other things, and trying to keep providing for them best that they can. And, I'm like, man, if I would have known that, like, I would have been like, hey, I want you in sports. You need help,
Yeah.
But now they can just do it. I want to play sports. Let's get this done at the school.
Yeah, right.
Travel school's really good at providing the after activity transportation. So like when they're done with their practices, the bus is still there to take them home.
Yeah. Wow. They're also hiring their home liaison as well, their home parent liaison, which I've been told like will literally like drive them to their appointments and places like that, like because it's all in the spirit of like enhancing their well-being, which is going to enhance their education, right, or their ability to focus in class.
Right.
And then another big thing that comes to mind about, like, you asked, like, why do they want to do this, is because behavioral health is moving towards integration, like health integration. So integrating not only just behavioral health, like therapy, but like physical health care into our services, substance use into our services, substance use treatment and prevention and things like that. It's integrated. So all different aspects of health, like, kind of coming together. And not only that, but like spiritual well-being, right? That's why we have our cultural specialists and thinking about how can they play a role in this. It really just like, it all goes together, and not just for the benefit of the client, but also to the benefit of the provider. Because like, for example, my role as a therapist, when I'm working with someone and they're telling me about like physical symptoms that they're getting, if I'm able to just refer them to our physician assistant and be like, hey, would you be willing to go get an exam? Then her and I can kind of coordinate together, right, for the well-being of the client. And I can understand, like, are these physical symptoms like something else that she needs to be treated for, or is this part of like her mental health diagnosis? Like, how do those play together, So it's like multi-beneficial for the client and for the providers and our agency.
When it comes to diagnosis and like, say, like their ear infections or their cough, where does the treatment come for, like, medication-wise?
So I believe it can still come from whatever pharmacy, right? I think they, as far as I'm concerned, they ask what pharmacy they prefer, but it's kind of nice because our physician's assistant is kind of like, has a branch at IHS, Indian Health Service, so she is able to just like kind of send over the prescription or whatever to IHS, and they can go right on over there too. She's also able to like do different things, like it talks about like labs and x-rays and things like that, like she can do that, and then just kind of, so she's able to like coordinate with IHS, so that like the students don't have to leave to go to IHS, rather they can just go to her and she can kind of get them what they need, right?
And that's one thing I like too, because as a coach at travel school, we are using this system called Final Forms. So it lets us know when kids is, like, the sports physicals is up, because there's a timer, and it actually counts down the time of how long their physical lasts. So if this is there, it'd be easier for our athletes to get access to that. So when they are there, I see that you have the hours here. So they'll be there through that whole time, or is that a certain time of the week?
So I will pull up the schedule here, the staffing hours. So actually I'm going to pull it back to the nurses. So this is the nurses there actually from 9 to 2 most days, aside from Wednesday. She's there 12 to 2 because we have our physician's assistant there on Wednesday from 9 to 12. So we kind of have that overlap. This has obviously changed a little bit, so and it's subject to change and whatnot, but we're trying to make sure that we market it to the students so that they can always access through these QR codes. Let me try to find them, sorry. Through these QR codes, they can always see, one, what services are we offering, right? And that's the schedule and whatnot. The services is the flyer, actually. The updates is like, what do we have updates? So one example would be like, this week I'm not going to be there on Friday. Instead, I'm going to be there to see therapy clients on Wednesday. That's just like one example. Or other updates, like, hey, this week we're going to have a talking circle, or we're going to have a group on healthy relationships or something, So they kind of know like what's coming that week. And then the provider and services schedule is where they can see, so they know like when the provider is going to be there and what services there are available, right? So we want to kind of, obviously, yes, go see the clients that we have already established, but also use it as like any time we have a behavioral health staff there on site, students, as long as they know their teacher knows where they are, they can drop in and just learn about our services if they want, and also like maybe get involved in the services. So for example, if they're wanting therapy, but it's on like, say like a Tuesday, they can go talk to Healthy Transition staff because Healthy Transition's there, and they'll be able to tell them about like, here's how you get into therapy, or actually I can just do your intake here if you want and we can get the ball rolling, you know, just like kind of creating an easier and like faster way to get into services.
Yeah, smoother way.
Yeah.
Them just being students, me being a parent, and them being under 18, how does it get them to like get services if they don't have their parents' permission, or do you guys gotta get the parents' permission, or?
Yeah, so there's so it's a little different for like healthcare, like physical healthcare, what Kate is doing, and then probably what the nurse is doing, versus like behavioral healthcare. So for behavioral healthcare in Washington State, if someone is over 13, they have the right to total confidentiality, which means that we cannot share anything aside from like the mandated reporting stuff, right? We can't share anything with like their parents or guardians as soon as they turn 13. With physical healthcare, it's a little bit different. There are certain things that the physician assistant will need to communicate with the parents. So that's where it comes in a little bit of a barrier, right? But there's also a certain age where they're able to just like, they can access healthcare services on their own, but it's just that if the parent is asking about that, she may have to share that with the parent, you know? So one example is like birth control, right? Mm-hmm. Like I can imagine someone coming in for birth control, maybe not wanting their parent to know. And so that's kind of where the transparency comes from, and then maybe a little bit of that education piece of like, okay, well, just so you know, like, yes, you do have the right to healthcare services because you're of age, right?
Yeah.
But also, like, say you go to IHS, like, our physician assistant is charting things in IHS, so if you go to IHS and your parent is asking for your record, they may see that on there, you know? So it's just about the transparency of, like, here's what does remain confidential, and here's what, you know, your guardian may have access to. And what do you want to do? You know, where do you want to go from here? Yeah.
Yeah. Makes sense.
Yeah.
So.
Well, you're next.
So that's everything, right?
Is that everything?
Well, kind of going back to the planning phase, because everything in behavioral health runs off, you know, grants, right? Was there any special grants that kind of help play into this?
Not at the moment, but that is something that I kind of want to look into. So like where we're going from here is like looking into funding of like how can we have like basically funds that are specifically for this, right? We do have a CCBHC grant, which is co-occurring behavioral health grant, which is kind of talks about like obviously behavioral health and substance use, so it's co-occurring, right? Where they have a mental health diagnosis and a substance use disorder.
Yeah.
That grant was able to provide some funding for like things like furniture for the clinic, so that like we can make like a safe space kind of thing for them. So we had our behavioral health aides basically design, they have this beautiful design of a layout of the room. They have everything covered from like a sensory corner to like where they can, you know, have all these different things for their senses, whether that's like kinetic sand or like a sound machine or something, or like something like that they can like lay on and feel or whatever, you know. And then kind of like a corner where like someone could just do some like regulation where like they're having a hard time in class, okay, if the room's available, they can come in, and the staff will be there to support them as well if they want, but also just kind of that supervision, you know, so they can self-regulate. And then just like they thought of all the different things, like, oh, the colors, like maybe you want this pop of color in there, and so they thought of like a lot of work went into the design, and so the behavioral health aides did really awesome with that. So CCBHC was able to provide some funding for that. As far as staff, all the staff that are providing services here are paid out of something separate, so it's not like they're paid out of the school-based health clinic, like they're paid out of their respective things, right?
Yeah.
But it'd be cool to get a grant that's like just specifically for this. All the funds can go to this. Also, tribal school has been really, they have funds that we can spend as well to put towards like supplies for the health clinic and whatnot. So.
Oh, okay. So, as this all planning was going on, what was like what was the biggest obstacle for you during the planning stages, getting things done for this?
I think just figuring out like what does that look like? Because I didn't have anything like that, you know, like when I was in school, I'm pretty sure we had a nurse, but like I didn't even know like what the nurse could do or like, you know, things like that. We had a counselor, but it wasn't like a therapist. It was like an academic counselor, you know. So like I'm trying to figure out like wrap my head around what does a school-based health clinic even look like. So it was a lot of research, and basically how we started was like bringing together people from each team kind of to like brainstorm together. And so I think that was the biggest obstacle, was figuring out like what is it going to look like? Because I'm telling you, like, we get to the first meeting, we're like, okay, we're going to implement a school-based health clinic, and we're all going to do, like, services there. And then everyone's just like, okay, you know? And so we're like, we have our second meeting. We're like, okay, so, yeah, so where do we go from here? You know? Like, then we have our third meeting, and we're like, okay, maybe we should do some research and look into, like, what does this look like, you know? So we did some research, and people were really kind of like, all hands on deck, like throwing in, right? And so it was really cool. The other thing that we really did was we did a community survey. So it was the tribal school community. It was the students, the staff, the teachers, the community, the parents. So we administered that survey and got the feedback, and it was a lot of questions of like, what does healthcare look like to you? What does that mean to you? What services do you have already in your school? What services would you like to see? And so that's kind of like the student focus, right? Like, what do they want? But also like part of the accountability, because the goal is later to like, we got that feedback of what they want, but later the accountability piece is going to be bringing together like an advisory board, and also like re-administering like surveys to see like, okay, how have services been so far? What can we improve, right? That's that accountability piece, to make sure that we're like upholding the standards that the tribal school community created with that baseline survey, if that makes sense.
Yeah. No, yeah.
Well, knowing that you've been going on for at least a month now, almost, do you have an idea of what it looks like going? How's it working so far?
I'd say it's going okay so far. It's just a little slow, and I think part of that is the marketing of like students. Well, for one, marketing students not knowing what exactly they can get. You know, obviously we have this list and everything, but then the other part is like students not necessarily knowing like, well, how do I get in there, you know? And so part of it is the marketing and education to not only the students but the staff. And we have been able to do this over, you know, their intercom thing. They have this big like WebEx thing where all the school can see. But I know that's a little less personal too, and like not everyone's always paying attention. Right. So the second piece to that is rapport building. So we have some staff that have gone in there that didn't have established clients already that they were seeing and had appointments for, so that was more so of just like walking around and kind of like building rapport, like familiarizing ourselves with the students, and also letting the students become familiar with us, like, yeah, we're going to be on campus on this day, and I'm going to be here on this day from this time, and I'll be in this room, so come see me if you want, you know, because like students aren't going to access services from people that they're not familiar and comfortable with.
Yeah.
Right.
Definitely.
You know what help what the marketing is? TikTok. Kids really like TikTok.
Okay, so you're going to create a TikTok for us?
Yeah, that's what I heard.
I'll be in it.
That's what I heard.
I'll be in it.
So what I'm hearing is you're going to volunteer to do the TikTok.
I'll do the voiceover.
Yeah, but we want, and that's part of the student focus, is like just how are we going to market to the kids so that they know, you know, the students, like, what are they on, you know, what platforms are they on, and that's why we kind of like moved towards that QR code thing, because we were like, well, students usually are using their phones, you know, but we also know that like one barrier in our community is lack of access to technology too. So we're trying to like also do it by word of mouth, and also just like kind of mingling with the students here and there, right? Yeah. Part of that is also like going to events, like if they're having school events, like the tribal school staff has encouraged us, like, come and join and be part of the community, so that they see you around, you know, and they realize you're part of the community too, and they'll feel a little safer with you. So.
Right. Because that's the thing I was just thinking about now, was because we already know that behavioral health already has like some type of stigma already, and knowing that we're going to go there and set up something there might be some type of, they might feel some sort of way.
Yeah.
You know, so I believe that if we do go in there and start working around with the kids, and then start showing up at events, I believe that they'll start getting comfortable around us too.
Yeah.
So what other outreaches have you guys done with the kids besides, just word of mouth? I mean, you guys gone to some of the classes and talked to some of the kids?
Yeah,
or?
so some staff have gone. It depends on the kind of what their care load is looking like when they go. So like when I go, I'm there from like, when am I there from again? 9 to 12 or something. And like I'm seeing clients that whole time kind of, so I don't have a lot of time where I'm like able to go out and mingle. But we do have some that like if they don't have like established clients, then they're like, yeah, I've just been kind of roaming around the halls like if during passing periods and just like waving and becoming a friendly face, The other thing is like when we had done the baseline survey, the needs assessment is what we call it, like what are their needs, what can we do to serve them, that we went to tribal school. So we were at a basketball game doing that, like we were going to the school, we've also presented during assemblies, things like that. Obviously we presented on the WebEx thing, right? So we've done that. But one big thing that I think is really going to kind of like break the ice a little bit more is when we have our kind of like our not really like grand opening, but like a little bit of a launch, like where we invite the community in to come look at the space so they can like see like what the space looks like and like become familiar with the staff. So all the staff that are serving the clinic will be there in that space as well, and then kind of like just mingle with people, maybe have like some refreshments, give them like a rundown of like, yeah, and invite parents as well, like if your students want access to these services, like here's how you can come in, yeah, so like something like that. That'll be a really big thing because I think it'll help not only with the students but also like the staff. They'll become familiar with the process a little more as well.
Conferences just ended as like you can do like a little open house with parents and students.
Yeah, open house. That's what we're gonna do. Open house.
Attract people. Everybody loves fry bread.
Okay, so Rachel's gonna make the fry bread. Jordan's doing the TikTok.
Jordan's fry bread's better than mine.
It's a team effort, people.
Just put us out there.
That
just made us.
I'll hold the phone while you make the TikTok.
Cameraman.
All about the
tripod. It made me think about the marketing for this, and I sat at that basketball game for like ever, felt like, but it was amazing feeling because like there was 10 kids around me at one point, and I was just like, hi guys, and they're all, what are you doing? What can I get? And all of them were like, I don't like promoting energy drinks, but they have milkshakes.
Because we were giving out Carly's gift cards if they completed the survey.
What's Carly's?
Right. But and it was nice to talk to the adults that had students there, that have students at tribal school, and hear their insight, and they're like, dang, it's going to be amazing.
Yeah.
Getting good feedback on it.
Yeah.
I think I got like 70 people that night or something. We're such a small like school based.
Yeah, we had over like 120 responses, or maybe over 100 at least, responses for the survey, and that was really good. And so some of that has been used in the kind of like our strategic plan kind of thing, right? But another big piece is that we want to kind of create that advisory board, like I was saying. And one of the biggest things for me is having a student on that advisory board, a parent on it, obviously some administration, and then, I don't know, just bringing in different, probably like an elder, or bringing in like different people from the community, like the tribal school community that we're serving, right? Because those are the people that are going to be affected by our services. So bringing them in so they can put their input on this, so we can reevaluate things and share that data with them, and kind of let that data like drive our work.
Do they have an ASB office?
I don't know. That's a good question.
Students? I don't know either.
Yeah.
I don't know. I know they have a media club, but I don't know about the ASB part.
Yeah, just getting like some student that's like really passionate about this, maybe that could be an advocate for the other students as well.
Definitely.
So.
Right.
But also just having that like youth perspective too, like even if they're not passionate about this, just that youth perspective of like, no, nobody's gonna like that idea, kind of thing. Someone that can kind of speak to the youth perspective.
How easy it could be for them to get access, or like their way of communication.
Yeah.
And how you break it down to communicate with them. Like I swear, like kids these days have a different language when it comes to media and texting and
Yeah.
videos and video
Right.
calling and words. I don't know like half the words they speak. It's like,
Yeah.
I understand, bro. I'm just like, really?
bro. Like, I'm a bro to my son. Yes, exactly.
Yeah. Yeah.
My oldest, Kaiden calls me that. Reese calls me that.
Yeah.
Maddie's calling me that now. I'm just like, oh my god.
Really, bro?
I'm not your bro.
Nicona's calling me that.
Well, it used to be it's the same word as dude. So
I'm going to pull up the second one because I had not showed the second one that also lists some of our services on the schedule. So I'm just going to put that up so that we can see that in case the audience is wondering what else we have. Yeah.
All right. Well, knowing all this information, I'm grateful that you're able to share it with us. Is there any other things that you would like to share, or any other events that you think would coordinate with this that you would like to share?
Yeah, I would just say stay tuned for the open house when we do have that. We're still trying to set up, like, as far as furniture. We want it to, like, the community to see it how it's going to be, right? Like, and so right now it's kind of just like a space, and, you know, we do have, like, an exam table, and on the physical healthcare side, that's kind of how it's broken up. So we have one portable that tribal school has designated for us to use for this health clinic, and it's nice because it's all in one building, right? We have the physical health care that has the exam table, the nurse, our physician assistant, the medical assistant, and then also the other side, which is more of that behavioral health care, where that's a lot of like more like case management, wraparound services type things like that, individual support around like life and academics, and then the clinical like therapy support as well. Another big thing that we, so it's not just like having to be in our services. Another thing is like bringing in groups. So like maybe VRP could do something about like teen dating violence awareness, or like how to have a healthy relationship, or just like things that are like that apply to this student population, right? Like things that are really relevant to them. And that might help reduce the stigma that we were talking about, is like if you just come and like you're kind of talking about this, you know, I know that they have talking circles there sometimes. So just kind of like talking about these issues without like calling people out and being like, okay, you're going to have therapy services, you're going to have these services, you know, it's more so of just like an education opportunity, right? Which could probably decrease the stigma.
Right. So, I like all that. I would like to even have just the students even just come in and sit down, just talk, you know. I mean, if we get one in, maybe one will bring another or something.
Absolutely.
So
Do a bring a friend campaign.
yeah, do bring a friend
There you go.
campaign.
I like that. I think it'll be nice too, because Bobby Joe, you're going to be going in, and you already have established some rapport with some of the students as the track coach, right?
Yeah.
So it's kind of nice, and I think that you could utilize that to your advantage. And we also have some people that used to work at tribal school, you know, that are kind of going into the clinic, and so they have that rapport already. So it's kind of like, how are we going to utilize our strengths to like meet the needs of these students, but also like recruit more students, and then this overarching goal of decreasing the stigma of accessing services, right?
Right.
Yeah.
Yes, indeed.
Okay.
You guys got any other questions before we close out?
I think
No?
I'm good.
No.
Okay. You got anything else for us? You
think
shared
so.
everything? Okay.
Yeah.
Just double checking. Well, thank you for listening to Understanding Behavioral Health Podcast. We hope you found the information helpful. If you have any questions or suggestions, please feel free to contact us. We would like to remind you that you are not alone. There are people who care about you. We want to get you help. If you are struggling with behavioral health issues, please reach out for help. There are many resources available to you, including the Yakama Nation Behavioral Health Program. We are here for you. We believe in you, and we know that you can heal. And before we end this, here's a little quote. Great things are done by a series of small things brought together, and that is by Vincent van Gogh.
Shook up.